and well, I mean, I didn't force her. I just laid the case out. I said, Tia, if you go into law, most of the lawyers I know are public defenders. They make Welcome, welcome, welcome to Health Issues. I'm your host, Chris Sylvain, and we have a dynamite show for you today. Dynamite, explosive, electrical. I'll put it in those terms. But we have a physician that's here, a physician, a researcher, and she's over at Tulane University, and I'll let her give the information. We have Dr. Colleen Johnson. Welcome, Dr. Johnson.
Thank you. Thank you very much for having me.
Good, good. So first, tell us your title and what you're doing over at Tulane, and then we'll move a little further. Go ahead.
Okay. So I'm an assistant professor of medicine over at Tulane, and I'm the director of the cardiac electrophysiology department.
That's what I wanted her to do.
Which is really just, you know, a fancy way of saying a doctor that specializes in heartbeats. And irregular heartbeats. Irregular
heartbeats. I love it. I love it. But I want to go a little bit too, because I thought that was fascinating, because Tulane University is you know, our prestigious university here in the city, and we're excited about it. But you didn't do your undergrad at Tulane. You were...
Oh, I was at other places. I started out and did my undergraduate and graduate work at MIT in Boston, and then I went on to medical school at Johns Hopkins University in Baltimore.
Fantastic. And some work in California too, right?
Yeah, I did my training, my residencies, and my 2 fellowships at the University of California, San Francisco.
That's why I called her a rock star, you know? That's right.
I wish.
No, really, in the academic world, you know, that's exactly, it brings the credentials necessary to speak at that level. Really, really good. So tell us, give us an idea of this. We talked about the term an electrician of the heart, an electrician of really the body itself, but this electrical work. To me, it is the most complex part of health of the body, these electrical circuits, and how do you treat them? What do you do? I mean, what's going on? Why is it so complex?
Right. Well, you know, I think about the fact that most people think of our body as our mechanical body. It's a physical, mechanical machine. Right. But just like your car, just like your computer, just like everything else, there's a physical and mechanical part of it. Right. And then there's an electrical component of it, which actually triggers a lot of the mechanical components. And so a lot of times in the body, the electrical signaling is what actually controls the mechanical work of the body.
All right. I go back to school. Okay. I'm sitting in class, and who was actually your colleague, Dr. Keith Ferdinand, you know, who had the show before you, turned it over, and we always appreciate him for that. And he was sitting in class talking about these electrical circuits. You know, he talks real fast. You know, I'm sitting in the back of the class, you know, trying to take these notes about, you know, about arrhythmias. And I'm like, what is he talking about? You know, so, but even in a medical community, it's really a specialized area, though.
It is a very specialized area. So for cardiologists, if we're going to train to go into this field, we train first as an internist, as internal medicine. Right. Then we train as a cardiologist, and then we actually go back and even do more training just in the electrical system of the heart.
Exactly. So it's a specialized part of cardiology itself.
That's right. That's right. And so just like most people have heard of the doctors that actually look at what I call the plumbing of the heart, right? That look at the arteries to see where blockages there could cause a heart attack. Right. Instead, I look at the electrical wiring of the heart just like an electrician would at your home.
Yeah, but the same thing with the electrician. One, he charges $120 an hour. You don't know what he's doing.
That's true. That's true. It is, and you know, I would even say that in cardiology, it can be a very subspecialized field to where, you know, a lot of times the other cardiologists, if I go too much into, you know, what I'm dealing with, kind of give me blank looks, like I'm not really sure what you're talking about, but
right.
Great that you understand it.
That's good. But all right, the question I always had was, okay, but you guys do understand. The issue is that when that heart rhythm kind of doesn't do the right two-step and the dance changes.
That's right.
I mean, but you actually can figure out many times what's going on.
That's right, but there are still times when we can't figure out what's going on, and I think that's part of the reason there are awareness campaigns like the one that we're doing now about sudden cardiac death. Okay. That there are some very clear things that can lead, and clear risks that can lead to people having sudden death, which is basically your heartbeat stopping. Okay. And then there are people that have this that have no risk factors, and we don't know why they have it.
All right, let's start with the easy one. You have risk factors, and so therefore there are things that people at home can think about and do, where the plumbing affects the electrical system.
That's right, that's right. So really the risk factors for having sudden death are things such as having other family members who have had sudden death.
Okay.
Having diseases of the heart, which include problems with the plumbing.
Okay.
Or problems with how strong the muscle is of the heart, and that's called heart failure. And so anything that contributes to those diseases, which includes, of course, smoking, diabetes, high blood pressure, high cholesterol, all of those things contribute to being at risk for sudden death.
Okay, now, so the greasy fried chicken, hamburgers, jazz fest food.
As we start festival season.
New Orleans. Right here, good old New Orleans. That's right. Eat to live and not
live to eat.
Live. That's right. That's right. While run, I never forget. There was this guy. He was running a half marathon, but he stopped and drank a beer.
You're just like, how did those two?
Only in New Orleans. All right, no problem. Okay, so those things affect the electrical circuits of the heart, the muscle. Now, can the muscle be affected without the plumbing being affected?
Yes, it can. So there are people that have heart failure, meaning the muscle of the heart doesn't work as strongly as it should. It's a muscle just like your arm muscle. And it's supposed to contract and push blood. And there are people that it does not contract well enough in, and it has nothing to do with the arteries of their heart.
All right.
And that again leads us into, there is a myriad of conditions that can lead to that, and then there are even people that we don't know why they develop heart failure.
Okay.
And so this is why medicine still has ongoing research.
Okay, I got it. So help me understand, percentage-wise, so the vast majority, though, the say 80% plus,
right?
Plumbing, chicken, muscle issues.
Right. So it's going to be plumbing first. In the vast majority of Americans, it's going to be plumbing issues first that causes the problem in the heart muscle. And those things then can result in problems in the electrical system.
And so people know, just like your drain gets clogged up, the vessels, the arteries and veins, and most likely the arteries are the ones, am I right?
It is the arteries that cause the problems.
Not the veins.
Not the veins.
The blood coming back, so it's no big. See, I went to
you
school.
Got it.
I did. Dr. Ferdinand.
He'd be proud.
Yeah, that's right. He'd be proud. Know the difference between the artery and the vein. So, but that's just it. So it's the arteries. They get clogged up, and more issues there. We'll talk about that later. No, but let's deal with it now. So therefore, if the arteries are clogged up, then you're dealing with heart muscle issues. And the current understanding is that it's inflammation that's really driving this thing. The inflammation that's happening in that endothelial lining, that's called, in other words, the pipe's are already sticky in the first place. So any of the stuff you throw down there, all the chicken and fat, sugar, fat, salt, and grease, it gets stuck. is there a relationship there between that inflammation and the muscle and the electrical?
So the inflammation part of it is true. There are people that die suddenly when they have decreased blood flow or a heart attack. That's what a heart attack is decreased blood flow to the heart.
Okay.
And there are people that do, because of that inflammation and death of heart tissue by the decreased blood flow, have a bad heartbeat that basically causes their heart to stop. It's not the fact that the muscle fails, it's the fact that the electrical system stops working. And so that's one section of the population that does develop sudden death, but the treatment for that is to fix the arteries. However, there is another segment of the population which, separate from the blockages in the arteries, like they've had blocked arteries in the past, now their arteries are open. But because of the damage that has already been done to their heart, they are at risk of dying suddenly because of a problem with the electrical system.
All right, I'm good. We're working. Work with me slowly.
No worries.
Okay. All right, now, so you can have a small percentage of people with electrical issues regardless of the muscle and the plumbing. So that's out the way, but that's a small percentage, I would think, right?
It is a small percentage of people, but I would remind people, you know, a small percentage of people out of 300 million people in the United States could be a couple million people.
That's a researcher. I love it.
You know, so even though we're talking about a small percentage, and, you know, I've seen it since I've come into New Orleans.
Really?
I've seen, you know, a young gentleman who dropped dead in a parking lot. Because he was on his way to actually see a physician because he was getting lightheaded. And so one of the awareness campaigns, this campaign that we're running, is to make people understand that you could have warning signals of having these bad heartbeats, and you should get them checked out. Because this young man was lucky enough that his sudden death, his heart stopping, occurred in a parking lot of a clinic. And so emergency medical people could get to him right away.
With the paddle.
That's right, and that's why another thing about the awareness campaign that is such of huge importance is for people to understand basic life support and what to do if you find someone unconscious and how to proceed in order to try to not only save their life, but to save their brain as well. All
right, now, so somebody with no blocked arteries, their heart muscle is perfectly fine. All right. So are there any risk factors at all?
So for this gentleman, he had something that a very small percent, as you said before, of the population is born with. He ended up having an extra electrical pathway in the heart that put him at risk for sudden death, and it's something that actually can be found on an EKG, which is when the doctor puts the leads on you and runs that pink strip of paper that shows the heartbeat.
Yeah, like on Dr. Welby, you know?
Yeah, exactly.
Yeah. All right. So I guess trying to narrow it here. So the average person, if they were going to a physician, they would have found that. You know, that's a part of an exam, am I correct?
Well, the biggest thing I would say is that if people don't brush their concerns under the rug, and I do think that there's a large portion of our population that says, oh, I got a little lightheaded, I'll let it go. And that's fine, you know, the first time, especially if you're out in the heat, you know. But if something is happening repetitively, if you're short of breath, if you feel palpitations, if you're having trouble with lightheadedness, if you're having chest pains, all of these are reasons to go to your doctor and let a doctor know so that you can be adequately evaluated.
Okay, that's good. And we're trying to look here, though, is that, but if you do everything that you're supposed to do, wellness and prevention, you know, the big concept of wellness and prevention. So if you focus on being well and taking care of the plumbing and taking care of the muscle issues and so forth, and there are no genetic things associated that if you're getting your exams, or at least had at least one or two of them sometime in your life, they would have done an EKG or whatever, and those genetic things are taken care of. All right, what's left? I guess that's my point.
So what's left is a term that physicians hate, but unfortunately we have to use some time, and that's called idiopathic.
You got it.
And we hate that term.
Right.
Because it basically means that we don't know.
All right,
we don't know why it happened to you.
That's good. Now, part of the public health campaign is that, you know, we don't want to diminish that, because whenever people feel bad, we want them to go to a physician.
Absolutely.
And that's where I'm going. I'm going to tell you where I'm going in the first place. I think because for people, if you're feeling bad, all right, hey, I'm a pharmacist, okay?
Mm-hmm.
We're the kings of self-medication. We help people kill themselves all the time, you know? No, I'm just joking, not for pharmacy. You know, hey guys, I'm with you. Okay, but the point of it is that everybody self-medicates.
Yeah.
And so what we're talking about here is that it's all right to self-medicate. You know, you're feeling bad, you're feeling weak, you don't know why it's going on, but there are some things that could possibly happen. And we won't use the word rare. Mm-hmm. All right, but particularly when dealing with the heart and heart rhythm, there's the symptoms of a bad heart rhythm can happen anywhere. Am I correct? It's not like you feel bad in your heart.
It can happen
headaches,
during
you can
sleep.
have. What's that?
It can happen during sleep.
Right. Exactly. So it's not like, you know, everybody says, hey, I have bad heart rhythm, so I know it's happening. No, you don't always know until they put the little gadgets on you, right?
That's right. That's right. Or until the event occurs itself. And so that's why I would say it's so important for family members to undergo basic life support teaching, which can happen at YMCAs, can happen at your local, a lot of times firehouses will have them, a lot of the universities offer them, and it's basically knowing how to assess and deal with someone who has lost consciousness.
Okay, but I have to go there though, because out of prevention and wellness, it is a small part of the population that doesn't have that there aren't other things that are going on.
That's very true.
To me, I think only because I think it pushes the idea of prevention.
Absolutely, and I would say just like you're getting to, there are a small group of the population where sudden death is not preventable.
Exactly.
That it is either congenital, meaning you're born with these risk factors, or it's idiopathic and we don't know why. But I would say that in the majority of people that undergo it, it is something that could be preventable. And one of those ways to prevent it is by doing everything that you're saying, by eating the right foods, by following the medications that your doctor prescribes to you, by not smoking. Right, you know, by exercising, getting out and walking, you know, even if it's to go listen to the music in the French Quarter.
That's right.
But get out and walk around, you know. And so I would say the majority of people that die suddenly, if we could have just caught them 20, 30 years ago and taught them how to do this, you know, how to live healthy better, we could have prevented it.
Okay, and we're in New Orleans because you can go, I mean, we go to the bus stop, and I figure 80% of the people have high blood pressure. You know, it's huge numbers of people with hypertension, let's say over 40. Realistically, over 40 in New Orleans, the amount of people that have high blood pressure is huge. I don't know the exact, but, you know, it's big time. So that means the vast majority of people in New Orleans, you know, over 40, realistically what we're saying that they're candidates for sudden cardiac death.
Yes, they are. And I would also say one of the important things that you just pointed out is that people don't feel high blood pressure a lot of times. People don't feel diabetes a lot of times until both diseases are further progressed, meaning they've been around for a long time or they've become significant. And so a lot of times people can walk around for years not knowing that they actually have these conditions, and that is also why we have primary care visits to do well checks. Just like we do for our children when they're first born, people need to do that throughout their life. It doesn't have to be frequent, you know, but once every couple years to go and just make sure that you do not have any of the markers for these diseases. You get your blood pressure checked, your doctor might do a blood test, and they might do an EKG. And just to check out and make sure that your health and wellness that we all are trying to promote and work so hard at is effective.
All right, that's good stuff. Two things I want to deal with real quick. One, the idea of asymptomatic. You know, you hear it all the time. When my pressure's up, man, I have a headache, or my big toe feels bad. I always know. I get a twitch.
Yeah.
And they don't know what they're talking about.
Well, I do find it amazing. I do know people that with their blood pressure and with sugars, they can pick out, oh, I know when I'm too high or I know when I'm too low. But usually those are people that have had these diseases for a long time and they've learned how to recognize these things. It's not when they initially have this. Most people initially say, oh, you know, I have a headache, I'll just take some Tylenol.
Yeah, but for those who do have those signs, do they get the signs 100% of the time when their pressure's up? So their pressure could be, you know, 220 over 145.
That's right.
And they didn't get the headache this time.
That's right.
Yeah.
That's absolutely right.
Yeah.
And that's again why you need to kind of follow up. That's why places like Walgreens and different supermarkets all around town, CVS's,
and
have blood pressure cuffs. Oh, and pharmacies absolutely have blood pressure cuffs for you to go in and you have one. You sit in a chair, you put your arm in, it measures it for you. And the reason we have these type of things at facilities is so that people can go in and kind of check it out.
That's right. I won't go there. There's a whole lot more to that story. All right. So that was the next question. Getting your blood pressure checked. We know an EKG is important also, but realistically, when you go to a primary care visit, rarely will you get an EKG at a primary care visit. People can go their whole life and never get an EKG. Am I correct?
That is absolutely right.
But you will get a blood pressure check.
Yes, you will.
But concerning sudden cardiac death, the blood pressure check obviously becomes one of the most important indicators to looking at when we're looking at sudden cardiac death than probably anything else that can happen in a primary care setting. Am I correct?
I would
anything.
say
That's kind of a broad way of looking at it.
No, and I agree with you. I think the single most important thing that happens probably at your physician's check is actually you talking to your physician.
Okay,
the history.
Good.
That your symptoms are probably the single most important thing.
Got it.
After your symptoms, we use that as kind of a guide to help us to look at the other tests that we get, which include all the vital signs like your blood pressure, your heart rate, your weight.
Right.
All of those things, including our exam, to help guide us in what your symptoms and these signs can lead us to as far as at-risk diagnoses. Okay,
now, so the next point, though, from prevention and what people can do for themselves, do you feel that the home blood pressure meter or getting your blood pressure checked at a pharmacy or wherever it's available becomes the most important thing in this case, one of the more important things that an individual can do to help themselves other than their regular checkups?
Right, I would say probably the two most important things that people can do at home is you can measure your blood pressure.
Got it.
And you can measure your weight.
Good stuff. Those two, let's talk. Can we have a few minutes? Can we touch up in there? Because I think that's what people are keying in on.
Of course.
Blood pressure and weight.
And I just think that people need to understand that there have been studies that have shown that having a healthier weight, so realize a healthy weight means also you're not too skinny, you're not too heavy, you're right in a healthy weight, is better for your life longevity, living longer.
Okay.
The other thing that is of importance is exercise.
Got it.
Because even without losing weight, it's been shown that exercise increases longevity.
Okay, good stuff.
And then blood pressure, keeping your blood pressure normal.
All right. It'll be another show on the lower weight. We'll talk about that. We're going body shape and so forth, visceral fat.
Absolutely.
And, those things. Yeah, we'll definitely touch on. I have arguments over the numbers because of the studies, and that's a whole nother area because I always say if they exclude the people that are already sick and that's why they have lost weight, then the numbers actually change. And then if you look at waist size as opposed to just, but then that's a different issue. All right. Anyway, but look, okay, the relationship between blood pressure and sudden cardiac death. Let's talk about that. Is it just the pressure on the heart? Or it could be anything, but it makes me think, just a lot of pressure.
It's both. So one thing is pressure in the heart leads to pressure in the arteries. So pressure in the heart leads to artery disease. So it's one of the risk factors for having a heart attack and having scar form in the heart because of having a heart attack.
Okay.
It also causes, as you just said, pressure inside the heart. And that pressure inside the heart makes the heart actually remodel. It's like looking at your arm muscle and lifting a 5-pound weight all the time. We get our nice little muscles with a 5-pound, but then if you lifted a 50-pound weight, your muscle gets bigger, right? So blood pressure is like how much weight you're putting in your hand.
Got it.
And the problem is that when the heart creates new muscle, in response to that higher weight that it's working against, that higher pressure, that muscle it lays down is not in the right architecture.
Got it.
And so that alone can lead you, and over time it will lay down extra muscle at first, and then that extra muscle will fail. And so it's a progression and can lead to the heart failing, meaning the muscle weakening.
Watch this. I was just doing the remodeling. All right, that's when, all right, let me get it. That's when a plumber lays down all these pipes and the carpentry guy throws wall up, but nobody tells the electrician what's going on.
Yeah. That's why you need a contractor. That's why you need your primary care doctor. Right there.
I got it.
That's your contractor.
That's it, because the electrical part, it just never gets right. Am I correct?
Right. It's like throwing up a wall and all of a sudden you've either split that wire or you've put the wire in a different mechanism way, and it creates problems for the heartbeat.
People not taking their blood pressure medication, that becomes the #1 issue at that point. Am I correct?
Yeah.
They would just take the medicine.
If most patients just stuck to their medicines and followed up with their physicians, I do think that overall they would have a much healthier result.
Lack of physicians, and I think that is key. When we talk about prevention, as you can see, hey, I push prevention. You know, we'll always do, because most things happen away from the doctor's office. That's 30 minutes a year. You know what I mean? For most individuals. So the rest of the world is outside. But people have to have a physician. It's not optional.
It isn't, and I know that it is extremely hard sometimes to get into a primary care physician. In addition, sometimes it's extremely hard to trust the physician that you are with. And I would recommend to people, for anything you go to, if you went to a lawyer and that lawyer you were working with they didn't explain things right to you, they weren't managing your business well, they weren't helping you in your case, your legal case as well, you would go and find another lawyer. And you would find one that you can develop a working relationship with. And in some ways, doctors are the same way. We all have different personalities, we all have different approaches, and I think you need to find the physician that works well with you in order for you and the physician to be successful in your health care.
Well, real good. If you can go right to that camera, let's talk about your campaign. We have about 30 more seconds, if you can do that.
Okay. So we're having a sudden cardiac arrest campaign called Arrest the Risk that's being sponsored by the Heart Rhythm Society of America. We're basically trying to educate people as to what are the symptoms of cardiac arrest, how to, if you're a bystander, help someone that suffered cardiac arrest, and which physicians in order for you to see to help you deal with cardiac arrest.
Thank you so much. Health issues, awesome physician. Do everything you can. Make sure you take care of yourself. Go see a doctor and do all that you can. You are somebody to be reckoned with too. Thank you so much.